Hey guys, sorry, we're gonna flip it around. Hi there. Okay, so hope y'all are doing well. Hope you got outside, got some sun. If you can see my head, can anybody see my head on here? It's way too red. Saturday was really nice. It was kind of breezy, you know, good weather. I wasn't expecting my head to look like this. But today we want to talk about your cervical spine. A lot of people have been sitting, looking down, sitting in couches, sitting in recliners, sitting at desks at home. Maybe we've not been as active. And I want to talk about this neck thing because, number one, it controls and coordinates or protects the neurology that controls and coordinates every single function in the body. So the brainstem, the spinal cord is very intimately connected at the very top of the neck. And so it's super, super impactful. You guys remember Christopher Reeves had a fracture at C1 at the very top of his neck, which means he lost bowel and bladder function. Had to have a machine pump his heart, pump his lungs, all of those things because the signal wasn't getting from his brain to his body properly. And so if you just look, so what I'm talking about is this. So we have this brain sends messages down the spinal cord and out through these spinal nerves to all parts. This curve in the cervical spine, I'll show you in a second, is supposed to be look like a C curve, an arc. And then these nerves, again, they go to all things, everywhere. It has a major impact on our blood pressure, has a major impact even on our digestion through the vagus nerve. Obviously controls our vision. My chiropractic story was I used to get headaches and realized, long story short, found out that it was all because of my neck. When I was in chiropractic school, and even now, if I had a test or something like that that I know I needed to study for, getting adjusted would allow me to be able to focus better. We see kids with ear infections and they clear up over a period of time because that controls the eustachian tube. So the upper cervical spine, I'm just going to grab this model here. This cervical spine is so important, and again, it's supposed to be shaped like a C. But what can happen, because we're looking down all the time, we lose the normal curve. So this thing right here is our spinal cord, and these guys right here are spinal nerves, okay? So we lose the normal curve. The spinal cord is intimately attached to the spinal column, so it's not just floating around. The dura, the wrapper of the spinal cord, attaches to the spinal bones via the meninges. Y'all have heard of the meninges. So when we have if we have rotational malposition, if we have flexion or extension malposition, if we've just lost the normal curve, it's like stretching a tube. And research has shown that diminishes the signaling, the effectiveness of the signaling from the brain to the body, and creates more than just pain. But definitely, I've never seen a headache person that didn't have neck issues. And there's been very, very few people, it's close to my heart, there's been very few people that we are not able to help that have had neck pain or that have had headaches, because most of that issue is coming from their neck. And there's some vitamin supplements that we do, there's some foods that we take away, make sure we drink more water. So anyways, if you want to come with me, there's some things that y'all can be doing at home. Again, we've talked about this. We've gone through the lots of different, so just kind of go over this way. So we've gone through the different things. This is always a problem that we have to be adjusting for. So again, this is an upper back issue, but you know, they're kind of related. So we did a video not too long ago on what to do for your upper back. So go back and watch that. If you have any questions about it, please let me know. But now we want to talk about the neck. And so we get stuck in this position a lot. Again, now I haven't necessarily done an exam or an x-ray with the people that are watching this video, so I don't know that this is exactly appropriate for you. Extension can cause some people problems. And so if any of these things hurt, don't do it. This is, like I said, general information. You know, it's not classified as doctor-patient relationship medical advice. So anyways, we do want to have a good C curve though when we're sitting. We want to be aware that we're not slouching. Research shows for every inch that our head is forward from our center of gravity, it adds 10 pounds of stress to our spine. And so the first thing we want to do, like when we're at home, just looking up, sitting in a chair with our back straight, not slouched and trying to do it, doesn't work. So back up straight, just kind of let our head hang back here. Again, if that's painful, that's probably a problem and your spine should be evaluated. Again, we see x-rays where the cervical spine is going the wrong way and it's been stuck that way. Causes things to wear out faster than they should and all kinds of other issues. But the other thing you can do, never ever do this where you're turning and twisting the head either direction. If you look at your pocket, we can stretch these muscles here this way. I take my hand and put it on top of my head and I just let it rest. But I'm not pulling down. So I'm just letting the weight of my arm do this. Sometimes I don't need that. I'm just doing this. Okay. So first one, I'm just gonna do extension and maybe it's for 10 seconds. Maybe I work up to 30 seconds or a minute. And then I can go side to side. And I can tip my head just straight over to the side too. We like doing motion first, so you're just gonna go in motion this way. Here you can go here, roll it to the other side, here, roll it to the other side, here. If you wanna do a static stretch, you can do that. 30 seconds, 45 seconds at a time. You can grab a chair and just lean your head over, pull down on this. Same thing, that'll increase the stretch. So that's the stretching. I would for sure recommend warming up first. So we're just gonna look to the right, look to the left. Do that 10 times, don't make yourself dizzy. Tip your head one side to the other. Again, we're gonna do that several times. And then we can kind of rotate from one side to the other, back and forth. I don't like this because it can create some pain for people. So anyways, once we've gotten that warmed up, you can either take a towel, if you don't have one of these devices already. This is our kind of our spinal remodeling that we do here in the office. This is called a Denerol. You could use a towel too. Again, it's important to know where the curve is misaligned because that tells us exactly what position the person should be using this wedge. How do we know that? An x-ray. If you've never had an x-ray of your spine, you really, really, really need to. It'd be like never having an x-ray of your teeth or never having a detailed examination of your teeth would be a bad idea. And I think your teeth are important, dentists, I think your teeth are important. But your cervical spine is protecting your spinal cord, so it's even more important. So, this goes here, I'll swing it around this way then. So I'm gonna go, this is gonna go under my head here, good. And I'm just gonna let my head hang back over this fulcrum, just like that. And I'm gonna start with a minute, and then I'm gonna work up. So I'm gonna then do a minute 30, and then I'm gonna do 2 minutes, and 3 minutes, and 4 minutes, and 5 minutes. And so, really good kind of routine would be doing the roller. So we roll back and forth and try to do that for 5-6 minutes, working on our upper back. We do our scapular retraction exercises. And so we're doing this and looking up at the ceiling, and we're kind of trying to warm things up a little bit. And we do that for 30 seconds, a minute, 2 minutes, 3 minutes, whatever we work up to. And then lastly, we do the remodeling, so the molding with the cervical spine, again with the Denerol or with, you could use a towel. Again, I would say to be a little bit cautious doing these things on your own without actually knowing that they're good for you to do or knowing what your x-rays look like. But hopefully some of those things can be helpful. Again, chiropractic is the absolute most effective thing you can do for headaches and neck pain, radiating pain, numbness, tingling. Guys, if somebody's getting radiating numbness and tingling Almost always it's coming from the neck. But the problem is, as that gets worse, it could actually lead to loss of function, not being able to use the hands properly. So don't ignore numbness, tingling in your hands. That's always a bad thing. And even the occasional kink or the pinch in the neck, that's also telling you that there's a problem and it needs to be investigated. Again, that arc of life is sending the power that runs the body, intelligence to every single cell, tissue, and organ in the body, and that area is protecting it. So super, super important. Matt, do we have any questions? Hope y'all are doing well. Hope you guys got some sunshine. Hopefully you didn't get as much sunshine as me. Share this with somebody that's having neck problems that needs to do it. But even more importantly, I would suggest being able to try to get into an office to have the cervical spine evaluated, to find out where it's not working right, how it's not working right, get some chiropractic work done. Just to let you know, we've been open this whole time. We've been following the CDC and the local health department regulations. We've already been doing the distancing. We've already been cleaning between patients. We've already been wearing masks. So it's as safe as it can be. We need to get back to taking care of our health. And I think that's it for me. If you guys have questions, please let us know. Hope you have a great night.